Pneumonia is a major respiratory condition impacting millions across the globe each year. Its effects can vary from mild discomfort to life-threatening illness, especially among vulnerable groups like the elderly, young children, and those with chronic health conditions. Pneumonia is a lower respiratory tract infection primarily affecting the lungs, particularly the alveoli, which are tiny air sacs vital to the respiratory process. Normally, air travels through the trachea, down the bronchi and bronchioles, finally reaching the alveoli. These grape-like clusters, surrounded by capillaries, are where gas exchange occurs. As blood flows through these capillaries, oxygen diffuses from the alveoli into the bloodstream, while carbon dioxide makes the reverse journey. In pneumonia, however, this process is severely disrupted. The alveoli become inflamed and filled with fluid, a process called consolidation, where the once airy sacs become dense and firm. This inflammation and fluid buildup hinder effective gas exchange, resulting in the characteristic clinical features of pneumonia: persistent cough, shortness of breath, and hypoxia. Pneumonia can be caused by various pathogens, such as bacteria like Staph aureus, viruses such as influenza, and fungi like Histoplasma capsulatum. Parasitic pneumonia, while rare, can occur due to parasites like Toxoplasma gondii. Pneumonia is also classified based on where the infection was acquired, as certain environments are prone to specific microorganisms. Understanding where the infection originated allows for more precise treatment, targeting the pathogens most likely present in that setting. The most common is community-acquired pneumonia, or CAP. This form of pneumonia is contracted outside of a hospital or healthcare setting. Typical bacterial causes include strep pneumoniae, Haemophilus influenza, and Staph aureus. Atypical bacteria such as chlamydia, mycoplasma, and legionella can also be involved. Viruses such as influenza, adenovirus, RSV, and coronavirus are common culprits as well. Although rarer, fungal infections like Histoplasma, coccidioides, and pneumocystis can also cause this type of pneumonia, especially in immunocompromised patients. Healthcare-associated pneumonia, once defined as pneumonia in non-hospitalized individuals with recent healthcare contact, such as those visiting dialysis centers, infusion centers, or living in nursing homes, is no longer a separate category. It is now generally included under community-acquired pneumonia. Hospital-acquired pneumonia develops in patients 48 hours or more after they've been admitted to a hospital. Unlike community-acquired pneumonia, HAP arises in a healthcare environment where patients are exposed to more resistant and potentially more dangerous bacteria. Ventilator-associated pneumonia is a severe lung infection in patients who have been on mechanical ventilation for over 48 hours. The endotracheal tube disrupts natural lung defenses, such as coughing and the mucociliary escalator, allowing bacteria easier access to the lungs. Moreover, bacteria can form biofilms on the endotracheal tube's surface. A biofilm is a protective layer bacteria create, serving as a reservoir for persistent infection and enhancing their resistance to antibiotics and the body's immune system. HAP and VAP often involve similar pathogens, including Staph aureus, Pseudomonas aeruginosa, Klebsiella, and E. coli. Pneumonia can be classified based on how the infection affects different parts of the lung, also known as its patterns of anatomic distribution. Bronchopneumonia affects the bronchioles and adjacent alveoli, causing patchy consolidation throughout the lung. Lobar pneumonia leads to the consolidation of a large portion of a lobe or of an entire lobe of the lung. It progresses through distinct stages: congestion, red hepatization, gray hepatization, and resolution, each reflecting different phases of inflammation and tissue changes. The body has a complex defense system against respiratory infections. In the upper respiratory tract, the cough reflex expels harmful particles and microbes, while proteases in respiratory secretions break down potential invaders. IgA binds to pathogens, preventing their attachment to airway cells and effectively blocking their entry into the body. In the lower respiratory tract, cilia move mucus and trapped pathogens out of the lungs, a process known as the mucociliary escalator. Surfactant, which reduces surface tension in the alveoli, has antimicrobial properties. Lastly, the alveolar macrophages patrol the alveoli, engulfing and destroying invaders that bypass the upper defenses. Pneumonia occurs when the body's defenses are either overwhelmed by a large number of pathogens or by a particularly virulent pathogen. It can also develop when these defenses are compromised. This includes impaired ciliary function in smokers, mucus buildup from conditions like cystic fibrosis or COPD, and a weakened cough reflex in individuals with neurological impairments. Additionally, those with compromised immune systems, such as individuals with HIV, diabetes, or those on immunosuppressive medications, are at increased risk due to their reduced ability to fight off infections. Pathogens can enter the lungs and cause pneumonia through three main routes: inhalation of airborne pathogens, aspiration, and hematogenous spread. Aspiration pneumonia occurs when food, liquids, oropharyngeal secretions, or gastric contents are accidentally introduced into the lungs. The risk of aspiration is higher when the gag reflex, cough reflex, or swallowing ability is compromised. This is often due to conditions like stroke or central nervous system depression from alcohol or sedation. Gastric contents, including stomach acid, can be particularly problematic as they not only introduce bacteria, but also cause chemical irritation to the lung tissue, worsening the inflammation. Pathogens can also spread to the lungs through the bloodstream, a route often seen in cases of intravenous drug use or severe infections. This pathway is, however, less common. When pathogens reach the alveoli, they are engulfed by macrophages. These macrophages then release pro-inflammatory cytokines like TNF-alpha and interleukin-1, which attract neutrophils and other inflammatory cells to the infection site. Macrophages also present antigens to T cells, triggering an immune response that activates the complement system and produces antibodies. This inflammatory response increases the permeability of the lung capillaries, causing fluid and proteins to leak into the lung tissue. The resulting fluid and immune cell accumulation disrupts normal lung function and impairs gas exchange, leading to pneumonia symptoms. Common ones include a cough that may be productive, shortness of breath, and sharp chest pain that worsens with deep breaths, known as pleuritic chest pain. Patients also experience systemic symptoms such as fever, headaches, sweating, and chills. Physical exam findings may vary. General examination could reveal tachypnea, tachycardia, or signs of respiratory distress. Focal lung findings may include increased tactile fremitus over areas of lung consolidation during palpation. Percussion over these consolidated regions typically produces a dull sound. Auscultation with a stethoscope may reveal decreased breath sounds and crackles. Other signs of consolidation on auscultation include bronchophony, where the patient's voice is unusually loud and clear over the affected areas. Egophony, where the voice sounds nasal or has an A quality when the patient says E. And whisper pectoriloquy, where whispered words are heard more clearly over the consolidated regions. Diagnosing pneumonia involves evaluating clinical symptoms, physical exam findings, and various tests. A chest X-ray is the main diagnostic tool for confirming pneumonia, displaying areas of lung consolidation. In cases of uncertain diagnoses, treatment failures, or suspected complications, a CT scan may be needed for a more detailed assessment. Lab tests also play an important role. A complete blood count can show elevated white blood cells, indicating infection, while inflammatory markers like C-reactive protein and procalcitonin assess inflammation severity. For moderate to severe cases of pneumonia, sputum and blood cultures should be done before starting antibiotics. Pulse oximetry measures blood oxygen levels to gauge hypoxia severity. Depending on the case, tests for serum urea, creatinine, electrolytes, and liver function may be useful. Respiratory viral panels can detect specific viral pathogens such as influenza and coronavirus. Urinary antigen tests identify bacterial pathogens, including strep pneumo and Legionella. Pneumonia treatment is tailored based on the type, its severity, and the patient's overall health condition. CURB-65 and the Pneumonia Severity Index, or PSI, are tools used to assess pneumonia severity and guide treatment decisions. Bacterial pneumonia is treated with antibiotics selected based on the suspected or confirmed pathogen, local guidelines, and patient factors. Common options include macrolides, fluoroquinolones, or beta-lactams. Viral pneumonia is managed with supportive care involving rest and hydration and, if necessary, antiviral medications such as neuraminidase inhibitors. Fungal pneumonia requires antifungal treatment, such as fluconazole or amphotericin B. Supportive care for pneumonia includes oxygen therapy for hypoxia, analgesics to relieve chest pain and general discomfort, antipyretics to reduce fever, and fluids to prevent dehydration. In severe cases, mechanical ventilation may be necessary. Monitoring for complications is crucial. These can include lung abscesses, which are pus-filled cavities in the lungs, parapneumonic effusion, where fluid accumulates in the pleural space around the lungs, empyema, a more severe condition where pus collects in the pleural space, and sepsis, a systemic infection that can spread to other organs. In summary, pneumonia is a lung infection that inflames and fills the alveoli with fluid, impairing breathing and oxygen exchange. It is caused by bacteria, viruses, fungi, or parasites. Pneumonia occurs when lung defenses are overwhelmed or compromised. Common symptoms include cough, shortness of breath, chest pain, fever, and chills. The diagnosis is confirmed with chest X-rays showing consolidation, supported by lab tests and CT scans as needed. Treatment varies by type and severity and involves using antibiotics, antivirals, or antifungals, with supportive care and monitoring for complications.